So as a chiropractor, you see a lot of people with pain and inflammation issues. What are your top recommendations for dealing with that?
Well, inflammation and pain is probably the number one uh, issue in America today. Uh, Not just back pain, but all types of pain: arthritic pain, gastrointestinal inflammations, uh, sprains, strains, etc., etc. Uh, I recommend a number of different things. With recent information coming out regarding salicylates or aspirin, as well as NSAIDs or non-steroidal anti-inflammatory drugs, possibly being detrimental to people who may have contracted the flu, and I think people can research this and Google it up themselves. Historians have gone back and looked at the spike in the death rate of the 1918 flu epidemic, and it followed the Surgeon General at the time recommending, as a general policy, high doses of salicylates or aspirin to possibly combat the flu. Unbeknownst at that time to the doctors and to the Surgeon General is that high doses of salicylate causes pulmonary edema or fluid in the lungs and reduces the ability of the lungs to clear mucus, and a lot of people were getting wet pneumonia and dying. And the biggest spike in the 1918 flu epidemic came after the announcement of the Surgeon General of the United States to use aspirin as an anti-inflammatory or as a treatment for the flu. So we're recommending people try and minimize their utilization of non-steroidal anti-inflammatory drugs as well as aspirin unless it's prescribed, and to follow those prescriptions at the lowest dose possible. But we recommend enzymes, amylase, lipase, protease, quercetin. One of the properties of quercetin is that it's both anti-allergic, anti-inflammatory, and it is a super antioxidant. And so quercetin is an excellent substance for systemic inflammation, especially gastrointestinal inflammation and allergies. We also utilize cat's claw and serrapeptase. Serrapeptase is a unique enzyme originally derived from silkworm, and now is able to be synthesized. That these enzymes actually go in and debride and get rid of broken down, damaged, and inflamed tissue and minimize the inflammatory cascade. The other thing that is highly beneficial is a balance of 3, 6, and 9 essential fatty acids, because they minimize the pro-inflammatory response or the prostaglandin response, and so they provide your body with what it needs to deal with inflammation, be it local or systemic.